The emergency room doors exploded open. A young black woman on the gurney, 28 years old, blood pouring from her abdomen, minutes from death. Dr. Marcus Whitfield glanced up from his clipboard, looked at her face for exactly 2 seconds, looked away. He should have looked longer, should have seen the curve of her jaw, identical to his own, should have recognized a scar on her left eyebrow from a childhood fall. But he saw only her skin, and in his mind, that told him everything he needed to know. He turned his back on his own daughter, without ever realizing who she was. The orderlies rushed past, their voices urgent, professional, desperate. Stab wound to the abdomen, massive blood loss. BP dropping, we need a surgeon now. One of them, a young man barely out of his 20s, looked at Dr. Marcus Whitfield with something approaching hope. Marcus Whitfield, after all, was St. Catherine Hospital's head trauma surgeon, the man with a reputation for saving lives others had given up on, the man who should have been running toward that gurney, not walking away from it. Sarah Chun, the lead ER nurse, moved with the practiced efficiency of someone who had seen too many critical cases to waste a single second. Her hands were already gloved, her mind already calculating blood volume loss, surgical priorities, the narrow window between life and death. Dr. Whitfield, we need you in or to immediately, she called out, her voice carrying the edge of someone who knew what minutes meant in trauma medicine. She's losing blood faster than we can replace it. We need to move now. Marcus stopped beside the gurney. For a moment, just a moment, he stood close enough to see her face clearly. The monitors beeped frantically. Her breath came in shallow, desperate gasps. And Marcus Whitfield looked down at this dying woman with an expression that made Sarah's blood run cold. It wasn't concern. It wasn't the focused assessment of a surgeon planning his approach. It was dismissal. It was judgment. It was something that had been festering in St. Catherine Hospital, like an infection no one wanted to acknowledge. Get Dr. Morrison, Marcus said flatly, already turning toward the doctor's station. Sarah stepped into his path, her 5'3" frame blocking his exit. Despite the size difference between them, Dr. Morrison is in surgery. You're the only trauma surgeon available right now. Her voice carried a warning, a plea, and the beginning of understanding that something terrible was happening. She doesn't have time, doctor. Every second counts. Marcus waved his hand dismissively, as if brushing away an insect. Page Dr. Chun from pediatrics then. Someone else can handle this case. Dr. Chun isn't qualified for abdominal trauma, and you know it. Sarah's voice went hard. She had worked with Marcus Whitfield for 6 years, had seen him perform miracles in this very emergency room, had watched him save lives that other surgeons had declared unsavable, and now she was watching him refuse to even try. What is wrong with you? This woman is dying. Marcus looked at her with eyes that had gone completely flat, empty of everything except certainty. His voice dropped low enough that only Sarah could hear, but the venom in it was unmistakable. These people come in here every week. Gang violence, drug deals gone wrong, looking for free health care they can't pay for. Let her wait. Maybe it'll teach her community to sort out their own problems instead of expecting us to clean up their mess every single time. The ER seemed to freeze. Doctors, nurses, technicians, all of them had heard enough to understand what was happening. In the silence that followed, the only sound was the increasingly frantic beeping of the heart monitor and the desperate gasp of a woman bleeding out while the man who had sworn to save lives walked away from her. Have you ever watched someone reveal their true nature? Have you ever seen the moment when the mask slips and the ugliness underneath becomes undeniable? Sarah Chun had been a nurse for 12 years. She had seen death and tragedy and human cruelty in countless forms. But nothing had ever made her feel as cold inside as the expression on Dr. Marcus Whitfield's face in that moment. The casual, calculated cruelty of a man who believed his prejudices more than his oath. Sarah pulled out her phone, her hands shaking with rage. The text message was brief. Emergency. Critical patient. Doctor refusing treatment based on race. Need immediate admin intervention, ER Bay 3. She hit send to 3 contacts simultaneously. The hospital administrator, the chief of surgery, and someone else. Someone she had been instructed to contact only in cases of severe ethical violations. Someone from a state medical board who had been investigating St. Catherine Hospital for the past 6 months, collecting evidence, waiting for the smoking gun. Marcus Whitfield had just handed it to them. Within 90 seconds, the ER doors burst open again. Dr. Rachel Morrison appeared first, still in surgical scrubs, pulling off her gloves as she ran. She'd been fighting Marcus's racism for 3 years, filing complaints that went nowhere, watching him dismiss patient after patient. Not this time. Behind her came James Cartwright, the hospital administrator, his face already red with barely contained fury. And behind him, moving with the calm, deliberate purpose of someone who had been waiting for exactly this moment, came a woman in a dark business suit carrying a leather folder that made administrators go pale. State Medical Board. Morrison reached the patient first. Her hands moved with swift precision, assessing the wound, her voice snapping orders. Or, 2 now. Type and cross 4 units O negative. Get her upstairs before we lose her. The gurney was already moving, nurses running alongside it, when Cartwright's voice cut through the chaos. Where's Dr. Whitfield? Doctor's lounge, Sarah said quietly. He refused to treat her. Said these people come in every week, and he wasn't going to waste his time on another one of these cases. 14 people heard him. The medical board investigator was already writing. And you're willing to provide a formal statement? I am. So are the others. They walked through the hospital corridors in silence, Cartwright's footsteps echoing like hammer blows. Nurses stepped aside, sensing the storm. When they reached the doctor's lounge and pushed open the door, they found Marcus sitting with his feet up on the coffee table, scrolling through his phone like nothing had happened, like he hadn't just sentenced a woman to death. He looked up when the door opened. His expression shifted from casual disinterest to something approaching concern when he saw Cartwright's face. James, what's... Shut your mouth. Cartwright's voice could have frozen blood. Shut up and listen very carefully to what I'm about to tell you. Marcus slowly lowered his feet to the floor. I don't appreciate the tone. If this is about the patient in the ER, I made a judgment call that you refused treatment to a critically injured patient based on race. The medical board investigators stepped forward, credentials already in hand. I'm Dr. Patricia Lawson, State Medical Board. You just gave me enough evidence to revoke your medical license. The color drained from Marcus's face. That's not what happened. That nurse misunderstood. I was simply trying to... There were 14 witnesses, Sarah said from the doorway. 14 people heard you refuse to treat her. Heard you call her one of these people. Heard you say her community needed to sort out their own problems. Marcus stood, his hands raised in a placating gesture that fooled no one. You're taking this out of context. In emergency situations, communication breaks down. I never intended. Dr. Morrison is in surgery right now, fighting to save that woman's life. Cartwright's voice was razor-sharp, fighting to undo the damage caused by your delay. If she dies, Marcus, if she bleeds out on that table because you refuse to do your job, I will personally make sure you never practice medicine again. She won't die. Marcus's voice had gone defensive. Morrison is excellent. And even if there were complications, you can't hold me responsible for her. For what? Refusing emergency care? Violating your oath. Dr. Lawson opened her folder. Inside was a photograph. Mrs. Eleanor Grant, 68 years old. Came to this ER with abdominal pain you diagnosed as drug-seeking behavior. She died 3 days later from a ruptured appendix. She looked up. She was a retired schoolteacher. Never used drugs in her life. But she was black, so you assumed. She flipped to the next page. 22 more cases just like her. 3 years of complaints, all from patients of color, all describing the same pattern. Dismissed, misdiagnosed, delayed treatment. That's coincidence, Marcus said, but his voice had gone hollow. Correlation doesn't equal. It equals exactly what I think it equals when I have this many data points. Dr. Lawson slapped the folder shut. And tonight, you handed me the smoking gun. The door opened and Dr. Morrison walked in, still in blood-stained scrubs, exhaustion etched into every line of her face. She looked at Marcus with an expression that made him take an involuntary step backward. "She's alive," Morrison said quietly. "Barely. She lost 4 liters of blood. Another 10 minutes and she would have been dead." She paused. 10 minutes she wouldn't have lost if you had done your job. Relief flooded Marcus's face, not for the patient, but for himself. A dead woman would mean the end of everything. See? Everything worked out fine. No harm done. Sarah stepped forward, her voice quiet, but carrying across the entire lounge like a verdict. "The harm, Dr. Whitfield, is that you were willing to let your daughter die." Silence. Absolute, crushing silence. "What?" Marcus's face went pale. "What did you say?" "Your daughter," Sarah repeated, each word landing like a hammer blow. "Maya Whitfield, the patient you refused to treat. The one you walked away from because you couldn't see past your own racism long enough to recognize her face." "No." Marcus actually staggered backward. "That's not possible. Maya's last name is Johnson. She changed it after we—" He stopped, unable to finish the sentence. "After I disowned her. After I told her she was dead to me. She changed it back 3 years ago," Morrison said, her voice acid. "Took her maiden name after her husband died. The same husband you told her she would regret marrying. The same man who, according to her medical history, was the love of her life." Marcus's legs gave out. He collapsed onto the couch, his hands covering his face. "Oh, God, what have I done?" "You refuse to treat your own daughter," Sarah said, and there was no satisfaction in her voice, just bottomless sadness. "You looked at her, and all you saw was her race. You didn't see her eyes, the same shape as yours. You didn't see the scar on her eyebrow from when she fell off the swing set at age 6. You didn't see anything except what you wanted to see." Marcus was shaking now, his breath coming in short gasps. "I need to see her. Please. I need to tell her I'm sorry. She doesn't want to see you." Morrison's voice was final. She woke up briefly. "When I told her you were the doctor who had initially refused treatment, you know what she said?" Morrison paused, letting the moment stretch. "That sounds about right. Then she asked me to make sure you were never allowed in her room. But she's my daughter." Marcus looked up, his face streaked with the beginning of tears. "I have a right. You gave up that right 12 years ago when you chose bigotry over love. And you sure as hell gave it up tonight." Dr. Lawson closed her folder with a sharp snap. "Dr. Whitfield, I'm formally suspending your medical license pending investigation. Surrender your credentials immediately and hire a lawyer because criminal neglect charges are coming." Marcus didn't seem to hear. He was staring at nothing, probably replaying the moment he had looked at Maya's bleeding body and seen nothing but assumptions. Seeing her now, truly seeing her, understanding what his hatred had made him do. "Can I at least speak with her?" His voice was broken. "Can I at least—" "No," Morrison said. "You don't get to walk into that recovery room and pretend to be the compassionate father. You're the reason she almost died." Marcus stood abruptly, desperation replacing shock. "I'm going to see her. You can't stop me from seeing my own daughter." He moved toward the door, but Morrison stepped into his path. She pulled out her phone, never breaking eye contact. Security. Doctor's lounge. Now. Within seconds, 2 security guards appeared in the doorway. Marcus looked at them, looked at Morrison, looked at the medical board investigator writing everything down, and finally seemed to understand. He had no power here anymore. No authority. No right to demand anything. "Escort Dr. Whitfield from the building," Morrison said. "He's no longer employed here." They took his arms, not roughly, but firmly. Marcus tried to pull away, then seemed to realize the futility of resistance. As they let him pass Sarah, he stopped. "Tell her I'm sorry," he whispered. "Please. Tell her I didn't know it was her." "Tell her?" "Tell her yourself," Sarah said coldly. "Oh, wait. You can't. Because she doesn't want to see you. That should sound familiar. Dr. Whitfield, isn't that exactly what you told her 12 years ago? That she was dead to you? That you never want to see her again?" They led him away, And the last anyone saw of Dr. Marcus Whitfield in St. Catherine Hospital was his back disappearing through the doors he would never walk through again as a physician. Hours later, after the hospital had quieted and the night shift had taken over, Sarah Chin sat in the break room with a cup of coffee she wasn't drinking. She was thinking about how close it had been. 10 more minutes, and Maya Whitfield would have been dead, killed not by the knife that had pierced her abdomen when she stepped in to protect someone else from an attacker, but by her father's blindness, by racism so deep he couldn't recognize his own child's face. But Maya had survived. Sarah made her way up to the recovery floor. She found Morrison standing outside Maya's room, looking through the window at the sleeping patient. "How is she?" Sarah asked. "Stable. Strong. She'll make a full recovery." Morrison paused. "I told her everything. About her father's refusal. About the investigation. About his license suspension." "What did she say?" Morrison smiled, but it was a sad, weary smile. She said, "Good. Maybe now he'll understand that actions have consequences. Maybe he'll finally learn what I tried to teach him 12 years ago, that hate doesn't just hurt the people you hate. It destroys everything you love." Sarah looked through the window at Maya Whitfield, sleeping peacefully despite everything. "Can I talk to her?" "When she wakes up." "She asked to see you, actually. Wanted to thank the nurse who saved her life when her own father wouldn't." An hour later, Sarah sat beside Maya's bed. Maya's eyes, so similar to her father's in shape, so different in what they held, looked at her with quiet intensity. "Thank you," Maya said, her voice still weak but steady. "Morrison told me what you did, how you reported him immediately, how you didn't let him just walk away." "I did what anyone should have done," Sarah said, "but most people don't." Maya shifted slightly, wincing. "Most people look the other way. Most people don't want to get involved. Most people let it slide." She paused. "I'm alive because you didn't." "I'm sorry," Sarah said quietly. "About your father. About what he did. About—" "Don't apologize for him." Maya's voice hardened. "He made his choice a long time ago. Tonight just made it visible to everyone else. Tonight, everyone got to see what I've known for 12 years, that his hate matters more to him than anything else, more than his daughter, more than his oath, more than his own soul." Sarah hesitated, then asked the question she'd been wondering since learning the truth. "Do you want to see him? If he tries to contact you?" Maya turned her head away, looking out the window at the city lights. "No, and not because I hate him, though there was a time when I did. I don't want to see him, because I've already mourned him. I mourned him 12 years ago, when he told me I wasn't his daughter anymore. I mourned him when he missed my wedding, my husband's funeral, every birthday and holiday. I mourned him until there was nothing left to mourn." She looked back at Sarah. "The man who refused to treat me tonight, that wasn't my father. My father died a long time ago, killed by his own hatred." Sarah stood to leave, but Maya caught her hand. "Tell him something for me. If you ever see him," Maya said, "tell him I forgive him, not because he deserves it, but because I deserve peace. Tell him I hope he finds his way back to being human again, but tell him he'll have to do it without me. If you believe racism poisons everything it touches, even love, hit that like button and subscribe to Story Arc. Because sometimes the hardest truth is that hate blinds us to the people we should see most clearly. And by the time we finally open our eyes, it's often too late.